Across our 10 health hospitals within our health system, we produce about 10 tons worth of medical waste related to one-time surgical use items or medical surgical use items. And from a perspective from the health system, that was a lot of waste that costs money and it costs labor, and it also leads to a negative environmental impact from a footprint standpoint. So we wanted to address the both financial aspects of that issue, as well as the impact that would have to the environment. What we found from data collection was a number of surgical use items and medical surgical items could be collected by certain vendors at no cost, but only about 10% of those were being collected and returned for credits or taken out of the waste stream. Those were labor intensive to put into place. So we identified all of the one-time surgical use items like the trocars, staplers, types of items, including the medical surgical one-time use items like pulse oximetry, disposable items, as well as bed alarms and what have you on the med-surg floors, and took all those items and took a deeper dive into seeing how much we could remove from the waste stream from vendor participation. So we sent out a request for proposal to multiple vendors to participate in collecting those materials. There's a few vendors out there that do collection of this nature, but very few of them do it at no cost, or they do it at a cost to the health system. So we sent out that RFP, got some return responses, selected a vendor who was willing to collect those items at no cost, and specifically it was a major vendor partner of ours that also contributed to quite a few of the one-time surgical used items. So for all of the surgical use items from that vendor, they would provide us a rebate back for those collected items. So not only did it was a win-win to take that out of the hands of our EVS team and processing for our OR teams, but it also provided a incentive back for the health system in form of a credit. After the end of the project and we awarded the contract to the vendor, we started to collect data from that vendor as well. Provided a nice dashboard of all the items collected, the rebates that were returned, and ultimately over the course of the year, we were able to remove 8 tons of waste from the landfill. And the company that took that was also a certified landfill-free vendor. So in their destruction of those items, they were landfill-free. Also, with the credits that we received back from the items that were collected by that vendor, it was about $60,000 to date. Well, for the 2019 collection year, $60,000 in rebates from the vendor, and also an avoidance of about $2,000 in medical waste collection costs.